by Carla Grau. Neonatal abstinence syndrome is a group of problems that occur in newborn who has exposed to addictive, illegal, or prescription drugs while in the mother's womb. Statistics. According to National Survey on Drug Use and Health, NAS appears among 54 and 94 of all babies who have been exposed to opiates in the uterus. The rate of current illicit drug in the used in the combined 2012 and 2013 data: 18.3% among pregnant women aged 15 to 17, 9% among pregnant women aged 18 to 25, and 3.4% among pregnant women aged 26 to 44. Well, here is a video.
And I'm currently the charge nurse in the NICU. I've been at CAMC for 26 years and have been in the NICU the whole entire 26 years I've been here. Some of the most obvious symptoms that we observe with the babies that come in, especially on admission, quite typically the babies are very irritable. They don't soothe very easily. They don't soothe with the types of things that we normally would have a baby to be soothed with, being that they could be held and be soothed, or perhaps given a bottle and be soothed by that. They are typically very hypertonic, very irritable. Sometimes you feel as if they're just trying to gather themselves to be able to be calm. And you do sense that, anxiety that they have, that they're unable to be calm.
The incidence in the country has risen about 3 to 4 times since over the last decade, so that the incidence of neonatal abstinence syndrome in the United States of America is approximately 6 per 1,000 live births. Unfortunately, here in West Virginia, we're seeing almost 10 times that amount, about 5.6% or 56 per 1,000. There are about 20,000 births in the state per year. So if you do the math, that's say 50 per 1,000, so it's approximately 1,000 babies being born per year that have neonatal abstinence syndrome, sufficient enough to have a longer stay in the hospital than they would normally. Average length of stay for these babies these days is about 2.5 weeks or 3 weeks, depending on how severe the symptoms are.
Before we have started medications, the treatment for these babies is essentially to do our best to provide that comfort, to provide that the consoling. And a lot of things that we do to the baby, we do keep a very low light, which is fairly normal in the NICU anyways. The babies respond very well to swaddling. They respond to holding, and just typical comfort measures that you can, just what you think of as obvious to console a baby initially. Then when we reach beyond that point, that's again when we start.
Types of drugs. These are amphetamines, barbiturates, benzodiazepines, cocaine, marijuana, opiates, narcotics. How? These drugs are passed on to the neonate across the placental barrier and can occur in varying degrees, depending on which drug was exposed. However, once the passage of drug is discontinued at birth, the infant's central nervous system becomes overstimulated, causing the symptoms of withdrawal. In some cases, the mother will take methadone opioid to reduce withdrawal symptoms for her and the unborn baby without causing the height associated with the drug addiction. Pregnant women depend on opiates, are maintained on methadone as current standard of care, which provides multiple benefits, including improved prenatal care, reduced fetal mortality, and improved fetal growth. In the hospital upon birth, pregnant mothers who deny drug use don't go to prenatal appointments. Fear of court-ordered drug tests, worry baby will be taken by the authorities. After the birth, a toxicology screen of the infant's first bowel movement, meconium, or a urinalysis is taken to assess amount of drugs involved. The doctor will ask questions about the mother's drug use, what drugs she took, when she last took them. This depends on the type of drug of the mother used, how the mother body breaks down the drug, how much of the drug she was taking, how long she used the drug, whether the baby was born full-term or early premature. Bloodly skin coloring, diarrhea, excessive or high-pitched crying, excessive sucking, fever, hyperactive reflexes, increased muscle tone, irritability, rapid breathing, seizures, sleep problems, sweating, trembling, vomiting. Premature births, lower birth weights, birth defects, small head circumference, sudden infant death syndrome, long-term cognitive and behavioral problems. Treating NAS withdrawal. Non-pharmacological treatment, dark white room, swelling to decrease sensory stimulation, frequent small feelings of hypocaloric formula, observation of sleeping habits, temperature stability, weight gain or loss, supportive care, IV fluids, electrolytes. Pharmacological treatment, 3 consistent scores higher than A on the AAS score include morphine, methadone, phenobarbital controlling irritability and insomnia and makes the infant easier to handle. Well, these are important: morphines, methadones, and phenobarbitals. What can we do? Encourage non-opioid pharmacologic management of pain in pregnant women, such as physical therapy or massage therapy. Encourage long-acting contraceptive management of women for reproductive age in opioid dependence treatment. Support mothers' education regarding NIS and make plans for baby sneaks. After delivery, consider weaning women from opioid treatment in a physician-supervised setting to help protect against the relapse. Help mother and family cope with life's challenges and connect with help resources in the community. Social support, financial, legal, housing, child welfare, domestic violence, and observation of risky behavior. Thank you.